The frontalis. The origin is the cranial fascia, and the insertion is the skin and muscles around eye. The frontalis is used to raise your eyebrows. The orbicularis oculi. The origin is the maxillary and frontal bones, and the insertion is the skin around the eye. The orbicularis oculi is used to close your eyes. The orbicularis oris. The origin is the muscles near the mouth, and the insertion is the skin around the mouth. The orbicularis oris is used to close and protrude the lips, as well as whistle. The buccinator. The origin is the outer surfaces of the maxilla and mandible, and the insertion is the orbicularis oris. The buccinator compresses the cheek inward. The zygomaticus. The origin is the zygomatic bone, and the insertion is the skin and muscle around mouth. The levator labii superioris. The origin is a zygomatic bone, and the insertion is the skin and muscle of upper lip. They both raise the lip and mouth. The levator anguli oris. The origin is the maxilla, and the insertion is the corner of the upper lip. This lifts the corner of your mouth. The depressor anguli oris. The origin is the mandible, and the insertion is the skin of lower corner of the mouth. The depressor labii inferioris. The origin is the mandible, and the insertion is the skin of inferior lip. They both pull the lip and mouth inferiorly. The masseter. The origin is the zygomatic arch, and the insertion is the mandible. The temporalis. The origin is a temporal bone, and the insertion is the mandibular coronoid process. These two close the jaw. The sternocleidomastoid. The origin is the sternum and clavicle, and the insertion is the mastoid process of temporal bone. The sternocleidomastoid flexes and rotates the head. The trapezius. The origin is the occipital bone, the C7 vertebra, and all thoracic vertebrae, and the insertion is the spine of scapula and clavicle. The trapezius extends the head and adducts the scapula. In these next two clips, I use my trapezii and my sternocleidomastoid to move. In this clip, I lift my traps or my trapezii while turning. The external intercostals. The origin is the superior rib, and the insertion is the inferior rib. The internal intercostals. The origin is inferior rib, the insertion is superior rib. The externals elevate the rib cage for inspiration, and the internals depress rib cage for forced expiration. The diaphragm. The origin of diaphragm can be divided into three parts: the sternal part, the costal part, and the vertebral part. And the insertion of the diaphragm is in the central tendon that is shaped like three leaves. The diaphragm also assists inspiration. The diaphragm and the intercostals are breathing muscles. In this clip, I'm taking in a deep breath with my diaphragm and my intercostals. The external obliques. The origin is the lower 8 ribs, and the insertion is the iliac crest. The internal oblique. The origin is the iliac crest, and the insertion is the lower 3 ribs. They both tense the abdominal wall, and they assist the lateral rotation of the trunk. The transversus abdominis. The origin is the lower 6 ribs, and the insertion is the pubis. The transversus abdominis also tenses the abdominal wall. This clip shows me tensing my abdominal wall. The rectus abdominis. The origin is the pubis and the pubic symphysis, and the insertion is the xiphoid process of the sternum and the 5th to 7th costal cartilages. The rectus abdominis flexes and rotates the vertebral column. In this next clip, I'm using my rectus abdominis to move my body and rotate my vertebral column. The serratus anterior. The origin is the upper 9 ribs, and the insertion is the vertebral border of scapula. The serratus anterior depresses the scapula and pulls it forward, also elevates the arm above horizontal. In this next clip, I'm using my serratus anterior to elevate my arm above horizontal. The deltoid. The origin is the acromion process, spinoscapula, and clavicle, and the insertion is the deltoid tuberosity of humerus. The deltoid abducts arm to horizontal. The pectoralis major. The origin is the clavicle, sternum, 2nd to 6th costal cartilages, and the insertion is the intertubular groove of humerus. The pectoralis major flexes and adducts arm. In this next clip, I'm using my deltoid to reach my arm out and my pectoralis major to pull my arm back in. The latissimus dorsi. The origin is the iliac crest, and the insertion is the intertubular groove of humerus. The latissimus dorsi extends or adducts the arm. In this next clip, I use my latissimus dorsi to extend my arm and then adduct my arm towards the midline of my body. The rotator cuff. The origin is the scapula and the insertion is the humerus. The rotator cuff is responsible for the angular and rotational movements of the arm. In this next clip, I use my rotator cuff to rotate my arm forward and back against my leg. The biceps brachii. The origin is the scapula and the insertion is the radial tuberosity. The biceps brachii flexes and supinates the forearm. The brachialis. The origin is the anterior humerus and the insertion is the coronoid process of ulna. The brachialis flexes the forearm. In this next clip, I'm using my biceps brachii and my brachialis to flex my forearm into this forward position. The triceps brachii. The origin is the scapula, proximal humerus, and the insertion is the olecranon process of ulna. The triceps brachii extend the forearm. In this next clip, I extend my arms forward by using my triceps brachii. The flexor/extensor carpi. The origin is the humerus and the insertion is the carpals and metacarpals. The flexor carpi and the extensor carpi move the wrist and hand. The flexor/extensor carpi initiate the movement in my wrists in this clip. Flexor and extensor digitorum. The origin is the humerus, radius, and ulna, and the insertion is the phalanges. The flexor and extensor digitorum move the fingers. In this next clip, I'm using my flexor and extensor digitorums to move my fingers. The iliopsoas. The origin is the lumbar vertebrae and ilium, and the insertion is the lesser trochanter of femur. The iliopsoas flexes the thigh. The gluteus maximus. The origin is the posterior ilium and sacrum, and the insertion is the proximal femur. The gluteus medius. The origin is the ilium, and the insertion is the greater trochanter of femur. The gluteus maximus extends the thigh, and the gluteus medius abducts the thigh. The adductor group. The origin is the pubis and the ischium, and the insertion is the femur and tibia. The adductor group adducts the thigh. In this next clip, I use my iliopsoas, my gluteus maximus and medius, and adductor group to bend and extend my legs in this lunge movement. The quadriceps femoris group. The origin is the ilium and femur, and the insertion is the patellar tendon that continues as a ligament to tibial tuberosity. The quadriceps femoris group extends the leg. The sartorius. The origin is the ilium, and the insertion is the medial tibia. The sartorius flexes, abducts, and rotates the leg laterally. In this next clip, I extend my leg and flex it using my quadriceps femoris group and my sartorius. The hamstring group. The origin is the ischial tuberosity, and the insertion is the lateral and medial tibia. The hamstring group flexes and rotates the leg medially and extends the thigh. In this next clip, I'm using my hamstring group to extend my thigh and rotate my leg. The gastrocnemius. The origin is the condyles of femur, and the insertion is the calcaneus by way of Achilles tendon. The gastrocnemius is in charge of the plantar flexion and eversion of foot. In this next clip, the gastrocnemius is initiating this movement. The tibialis anterior. The origin is the condyles of tibia, and the insertion is the tarsal and metatarsal bones. The tibialis anterior is responsible for the dorsiflexion and inversion of foot. The fibularis muscles, the origin is the fibula and the insertion is the tarsal and metatarsal bones. The fibularis muscles are responsible for the plantar flexion and eversion of foot. In this next clip, I'm using my tibialis anterior and fibularis muscles to plantar flex and dorsiflex my feet as well as invert them. The flexor/extensor digitorum longus, the origin is the tibia and fibula, and the insertion is the phalanges. The flexor/extensor digitorum longus moves the toes. The next clip, I don't have a clip of myself dancing, but it is my best friend, and she is moving her toes in a dorsiflex and a plantar flex. Thank you for watching. Here's me moving my ears, showing off my special talent. Yay!
Dream a little dream of me. Say nighty night.